In the Lone Star State, we cherish our freedoms and hold our families dear. But when it comes to healthcare, the challenges we face are as diverse as our people. Every day, Texans grapple with the consequences of bad actors in the medical field. That's why we created Texas Best Docs. We're here to help families protect their loved ones and make informed healthcare decisions. Welcome to Texas Best Docs, where we bring you the stories and insights of leading healthcare professionals transforming the medical landscape in Texas. Today's episode features Dr. Bruce Hermann, a good friend of mine and a renowned plastic surgeon specializing in breast and body procedures. Join us as we explore his inspiring journey, discuss the importance of healthcare transparency, and get his thoughts on the impact of Texas Best Docs. Hello and welcome.
Hey, thank you so much for having me. I'm really excited to be here.
Yeah, I love, watching your podcast.
Oh, you watch my podcast?
Yeah.
Oh, I'm honored. Well, thank you.
It's very interesting. Very interesting.
We try to make it interesting. It's informative entertainment is what I like to call it.
Yeah. And before we get, because we're going to talk about that, we're going to kind of get into the weeds on what goes on in your podcasts and everything. But first, what made you want to become a plastic surgeon?
Well, I think plastic surgery is the one specialty in medicine where you can use your artistic ability. I'm kind of an artsy guy. I like to play music, and I actually loved drawing when I was a kid. And so, plastic surgery is a nice marriage of science and art. And that's what really attracts me. And I did not go into medical school or even into general surgery thinking I was going to be a plastic surgeon. I actually wanted to be a trauma surgeon. And then I just kind of realized what exactly that was. And I was like, wow, it's just not maybe the best fit for me. And then I had a friend, he's like, you should check out plastics. You're kind of artsy. And I was like, I had this maybe almost like a negative connotation about plastic surgery. I don't know if you've ever gotten that feeling sometimes about plastic surgery. And maybe that was more prevalent 20 years ago. But I was like, yeah, I'll check it out. And I just loved it. I was using visuospatial skills to create something.
That's cool.
While doing surgery, I was like, this is for me. And so it's been a great fit.
Is it normally, where a trauma surgeon can naturally kind of go in that direction? That seems like it because you're dealing with,
Yeah, so that's all the pathways to get to plastic surgery. So there's two ways you can get to plastic surgery from medical school. The way I did it is I did a full general surgery training first because I thought I was going to be another type of surgeon, and then there's what's called fellowship. So I did 5 years of general and trauma surgery, and then 2 years of plastic surgery fellowship, and then I did an extra year of fellowship in cosmetic breast and body. And the alternative would be to go directly from med school into plastics. They call that an integrated program where you do basically 3 years of general surgery, so it's not like the whole training program. And then you do 3 years of plastic. So it's a little shorter, that route. So obviously everyone thinks their way is the best. I do appreciate the way I did it personally. So,
well, we've talked about many different stories. I've heard some really crazy stuff on your podcast.
Yeah.
And I do believe my jaw drops and I'm like,
I know some of these stories are almost unbelievable.
Okay. But kind of, touch on why you created the podcast. Sure. And what, first of all, for people that are watching or listening that maybe haven't seen your podcast, which we will put the information in the description below to go to his podcast so you can look for it there.
Yeah. So my podcast is called Nip Talk. Very clever. I thought that was very clever when I came up with that. But the reason that it all started was I got a little bit of notoriety on social media doing things on TikTok and Instagram. And so every Friday I would do this live stream from my office, and I actually would start out talking about maybe a patient I saw that week. And then, on the live stream, people would start asking all these questions, and it would just evolve into me asking questions about medicine. And it got kind of popular. And if I didn't do it on Friday, people would be pinging me hey, where were you? And so I think the podcast was a natural progression of that. And it's been great for me. I have to say there is some, personal gain in it that, plastic surgery is about branding, and having that podcast is great for my brand. Mm-hmm. But more than that, I love the educational part about it. I call it informative entertainment. And so we talk about segments that mostly I see in the news, or maybe I saw a patient that was interesting and it brings up a topic. And the whole focus of the podcast is to educate people on plastic surgery specifically, but also other health topics. And we touch a lot on maybe bad outcomes of plastic surgery in medicine, and not in any way to sensationalize it or anything like that, but it's to educate people. This happened to this person, this is why it happened, and this is what you could do to avoid that. So, the podcast has good intentions. I think if you watch the podcast, you learn a lot. And yeah, it is specific to plastics and some health and beauty stuff, but I think that it can make you a better consumer and also potentially save you from some potential bad things that can happen.
Yeah, I mean, because you're some of those stories, are essentially what Texas Best Docs' mission is.
There's a lot of we share a lot of beliefs here where we're trying to like help people make informed decisions. Yeah. So yeah, like I'm on board with like your project. I read about it, and of course you told me about it, and I think it's great because the one thing I found is that it can be hard for doctors to know what's legit and what's right. Like if I go to like my anesthesiologist friends and say, what exactly does it mean to be a plastic surgeon? What makes me legit? They're like, well, I don't know. Did you do some training? I mean, there's a lot that goes into that as far as, being properly trained and being properly certified. And if other doctors don't know it, how is a patient going to know? How is a patient going to go to a web page and know if the person that has this web page up that may look great, because anyone can throw up a great web page, how are they going to know that this person's legitimate? And so, I really applaud you guys for doing what you do, which is to, try to educate people on what makes a great doc. How do I find a great doc? I think it's great.
Yeah, because I mean, we always want you to Google and look up a doctor and what they have, but you can also pay for 5-star reviews.
Right.
So...
Yeah. In fact, we were just talking about that. I think you were around when I was doing my segment earlier. We had a story about a girl in Colorado that did medical tourism, which I am so against medical tourism, especially out of the country, but even in the country is a bad idea. And I think we have it. Do we want to run the segment?
Yeah, can we go ahead and run that clip?
Every year, around 14 million people travel across the world to receive medical care, seeking other cities than their own to go under. Well, tonight, Karen is sharing one Colorado woman's warning after she hopped on a plane for a mommy makeover in Miami.
2 weeks earlier, she and her family were in Miami, Florida. She'd found a board-certified plastic surgeon at Seduction Cosmetic Center who would perform what's often called a mommy makeover.
I was looking for a better body for, especially after 4 kids.
The family had arranged to stay for 5 days following the surgery. There were early signs of problems with the incision, which had turned hard and black. But Miriam says doctors told her it was just dry skin and sent her home to Colorado with an antibiotic ointment.
I was like, nobody's willing to touch me, not even in urgent care. What's going on? They are telling me that it's necrosis.
She says while the out-of-state cosmetic center continued to deny any problem, her stomach felt as though it was eating away at itself. Desperate, she reached out to Dr. Samir Hassan.
Not everyone's going to just say yeah, because 1, they're afraid of liability. 2, they don't necessarily always know what it is.
Despite his own concerns, he agreed to help. He found the necrosis was at her abdominal wall and would soon reach her organs.
She potentially would have ended up in a hospital.
Miriam has since had multiple surgeries to fix the botched tummy tuck and has spent countless hours searching for some way to hold the surgery center accountable. Attorneys saying we will not be able to help you.
It really depends, because Florida does not necessarily require its doctors to have medical malpractice insurance.
Raj Chauhan is a legal analyst for CBS Colorado. He says attorneys may be hesitant to take these cases because without malpractice insurance, they say it is just not economically feasible. For Miriam, she signed a document that explained that risk, and every attorney she contacted refused to look at her case. Still, Florida continues to see a jump in cosmetic tourism every year, with out-of-state patients flying in from across the country to go under the knife. Many don't always know what they're getting into.
Most of the people who are marketing themselves as plastic surgeons, they're cosmetic surgeons, and that means you didn't have to go through plastic surgery training.
The appeal largely comes down to cost, which experts say should be your first red flag. While Miriam did research the center online, she found only positive reviews, which she now believes might be fabricated. Today, she struggles to lift her children at times and is fighting a new anxiety about her body.
I wake up in the middle of the night, being traumatized, hoping that it's not ripped open again.
And while she may never see justice in a courtroom, she believes sharing her story will serve as a warning to others.
And stop them from what they're doing.
Pretty crazy stuff. What's wild is that's not even like one of the crazier stories that I see. Like that, the reason I use that one is there's a lot of really good information to learn from it. But as far as like bad outcomes, I mean, There's way worse than that. I mean, you guys probably look at those pictures and like, this is
I'm like, that's disgusting.
Yeah, this is the worst thing. But there's way worse things that happen out there. This one is good though, because there's the news article brought up so many just great points and educational things to know. And I mean, I don't know how far you want to dive into medical tourism, but I mean, the big problem that this poor patient had is, she went and had a major surgery, and then she leaves the location where her surgeon is 5 days later and starts having problems, and she's got no one to help her. And, a lot of plastic surgeons are reluctant to take on other people's complications, because there is that liability part of it. I do it all the time because I just feel bad for these people, and, I try to help them. But you really can get into a bind if you go out of the state to have surgery. And also, like, that place where she went, I mean, you're going to a place that you're not going for a specific doctor. You're not going to Bruce Hermann there. You're going to that corporation that is basically a mill of running patients through. And that one Dr. Hassan was mentioning that, it may not even be a board-certified plastic surgeon, and that's absolutely true. It said that hers was, and I actually looked that place up, and they have a mix of actual plastic surgeons and non-plastic surgeons doing the surgeries. So there's just a lot of, like, problems that patients find when they go out of a state to do a surgery like that. And I think what brought us to that was you talking about the Google reviews, and that's totally true. I mean,
they had over 2,000 reviews, and most of them are positive. And
I mean, there's ways to suppress those things too, and inflate them. I mean, that's where it just gets so hard for patients to know, who's good, who can I trust. As far as like what I would recommend, people do, and this is mostly for plastic surgery. I mean, I know my wheelhouse, of course, but making sure that your doctor, especially with plastic surgery, is board certified by the right board. There's only a few boards that are recognized as being legitimate. And so for plastic surgery, it's the American Board of Plastic Surgery. But there's like a cosmetic surgery board, an aesthetic surgery board. I mean, they'll give those boards to almost anyone. I mean, they'll give them to non-plastic surgeons. So if they'll give them to somebody who's not properly trained, what value does it have? Right. And so, I mean, doing research on your doctor is critically important, but you have to be educated to even do that. And
that brings me to a question for you. This is basically what Texas Best Docs does as an asset. It adds to it. So you can look up on Google, but then you can take another step and you can look up on Texas Best Docs just by writing in the doctor's name, because you may not, you may live in Colorado and go to Florida for surgery, or you may be there's a lot of transplants here in Dallas where you don't have a doctor, you don't know who to go to, and you've got to search. And, as we were talking before, there's a DFW plastic surgeon that has 5-star reviews like that and can't be alone in a room with a female patient. So it's like, you know what I mean? To know those things, you kind of have to. And so my question is, you said do the research. Like, what are some tips, advice, questions you would say to patients, before you go to a plastic surgeon?
Well, one, I'm definitely against medical tourism. It's just setting yourself up for failure. Don't do it. Find someone near you. I mean, if you live in like a rural town, you may have to travel to the next major town over, but don't travel out of state. Definitely don't travel out of the country. You do want to find a board-certified plastic surgeon, and that's where it gets kind of hard, because people will have these great websites like, oh, I'm triple board certified, and you go and look, and their board certifications aren't in plastic surgery, and patients almost get deceived. So American Board of Plastic Surgery is critical. From there, I think you want to go and have a good consult with them. You want to feel very comfortable that they are addressing your issues and your concerns and taking the time to make sure that your outcome is going to be what you expect. And you don't always get that. I think sometimes some plastic surgery places are all about how many patients can we turn out today. And that does put you at some risk of there being some miscommunication or misunderstanding in what the patient wants and what the outcome is going to be. And so the classic example I always use when I'm talking about this is, someone comes to me and says, I want a D-cup breast. I say, okay, we'll give you that. Well, how do we know that what they're thinking is what I'm thinking? I mean, things like that are arbitrary. Cup size, if we both molded clay of a D-cup breast, we might end up with two hugely different structures. So, you need to take the time, have that good consult, feel like the doctor knows what you're looking for, feels like that they have a plan to get you what you want. And then also do a good exam and just have an overall great feeling that you're all on the same page. If you get rushed through, or maybe he's having his nurse talking to you, you might want to find somewhere else. I mean, it's possible that you may get a good outcome, but, to me, the biggest way that you're going to have a good outcome in plastic surgery is having that great doctor-patient relationship. And that's why I don't like places like that I can't remember, seduction or whatever, where it's like a corporation. I mean, you're going to a corporation, not a doctor.
Yeah.
You know, the surgeon's the one that's going to make sure you have a good outcome, not some corporate, phase. So, but it's just hard. Like I said, it's hard to know. Like, you have to know what boards to know, what to look for, having the right questions. And that's why, one of the reasons I do my show, it's why you do what you do. It's like to get that education out there so people can be informed consumers and they can make wise choices so that they're, not going to go down a road that's going to, bring them to something that is a bad outcome.
And your podcast continues and continues and continues because there's story after story after story. So, one thing that Texas Best Docs also does is talks about the importance of healthcare transparency. And why do you think, being transparent in the healthcare industry is so important now, even now than it was maybe 10 years ago?
Well, obviously transparency in any business is a good thing. I mean, you don't want to feel like you're being misled or you don't know really what's going on. And I think, with the recent things like the pandemic, I think that there has been some loss of trust in the medical field, whether it be warranted or not. I think is, certainly debatable. But, I always tell my patients, look, I'm like honestly blunt. I'm going to be so honest with you that it might turn you off. And if it does, then that's fine. If I don't think you need surgery, I'm going to tell you, I don't think this is worth it. And so I feel like that served me well to have that level of transparency, just to be as, honest as I can with my patients. Because, for me and my specialty, you don't want someone to come out being surprised.
Right.
This isn't what I wanted. This isn't what I asked for. And I think transparency is the best way to achieve that. And so that does, is not solely for plastic surgery. Like, if you're going in to get other types of surgery, having your doctor be honest with you about what to expect and what are the risks and, not candy coating stuff, although it may frighten you, it's in your best interest. I mean, you're always going to have the best outcome when you're informed about what's going on. So yeah, I fully believe in transparency. I don't think there's enough of it. I think that there are docs out there that don't take the time to make sure that the patients are fully aware of what's going on, because I think as doctors, we almost get lost in the weeds of, I've been doing this so long that I just expect everyone knows what I know. Mm-hmm. And then you start talking to people and you realize that simple things that I take for granted, someone has no idea about. Mm-hmm. And, maybe I guess some of the transparency issues are not intentional. I mean, I even catch myself. I try so hard to make sure people understand what I'm talking about. And every once in a while I'll say something and someone's like, oh, what does that mean? I'm like, oh my gosh, I'm so sorry. I just forget that this is not common knowledge. So, but yeah, I'm not sure every doctor goes to that level of extreme,
So going back to you being blunt, which is one of the things I absolutely love about you. But, we were talking ahead of this. I was kind of going over some of the questions I may ask. But
sure,
new trends in the plastic surgery world, there's a couple that you bluntly say, I won't do.
Yeah, absolutely. So some of the things you'll see the most on social media are things that are maybe not the greatest surgeries. And the one that comes to mind immediately is Brazilian butt lift. You see it on Instagram all the time. And I have to say that when I see the befores and afters, I'm like, yeah, that looks pretty good. But artistically I'm looking, I'm like, yeah, that's pretty good. But the reason I don't like the surgery is, Brazilian butt lift carries a significant mortality rate, so risk of death.
Interesting.
The average rate of death for elective cosmetic surgery or plastic surgery should be between 1 in 200 to 300,000. For Brazilian butt lift, it's 1 in 3,000. So you're talking about 1,000 times higher rate of mortality. The reason for that is the way Brazilian butt lift is done. I'm sure not everyone knows this. You're sucking fat out from areas that you don't want the fat, and then you're re-injecting the fat into the buttocks. Well, there's some really big blood vessels in the buttocks, and if fat gets into your bloodstream, that is a critically dangerous problem. You can absolutely die from that. And so most of the deaths that occur from Brazilian butt lifts are due to what's called fat embolism. It is a risk of the surgery, and it can happen even to doctors who are, being very careful. Other issues, I don't like it outside of the mortality rate, which alone should be a reason people should tap the brakes on that. I mean, when we talk about deaths on my show, it's very commonly Brazilian butt lifts, far and away the most common cause of plastic surgery death. But other issues, one, the fat that you inject always gets reabsorbed. It doesn't always get reabsorbed equally, so you can get problems with the contour. That's why I say when you see them initially on Instagram, you're like, oh, it looks pretty good. Well, what do they look like 6 months later? Also that fat can harden, so you can get areas where it doesn't feel natural. And then, the other issue too is, often run into times where, people want these Brazilian butt lifts because they don't have a lot of fat content, and that means that you're having to scrape fat from areas that you normally wouldn't get it from. and you're putting yourself at more risk. So to me, I look at it, I'm like, yeah, the mortality rate's too high. The long-term risks are just not for me. I'm out. And I talk very openly about how I don't like Brazilian. And I'm not alone. There are a lot of plastic surgeons don't want to wade into like controversy. They're like, I just want to fly under the radar. I'm like, I'll talk about anything. And so I'm always out there talking about it. And there are other plastic surgeons that will say the same thing I'm saying. Like, look, this is not a great surgery. I'm kind of against it. And you see that in the trends, like year to year, almost all plastic surgeries gain in popularity. Brazilian butt lift is staying pretty static. And it's not as many as you would think. I think it's 6,000 a year in the United States compared to 300,000 breast dogs.
Oh, okay.
Yeah.
Because I wouldn't know. I was like, okay,
Yeah.
What is that?
I think it's 6,000. I just looked these numbers. It was like 6,000, I believe, and it stays pretty static, which means it's not gaining popularity. The other one I don't like is the buccal fat removal. So this is your buccal fat right here. Like,
oh yeah, I was like asking you what that. Okay.
Yeah. So what was the girl from Game of Thrones? Sansa Stark. I can't remember her real name. It's escaping me. They think that she had it done. There was a question about Megan Fox having it done. There's a couple people we know have had it done. And it just, when you take the fat out of this area, it gives you that chiseled look. But the problem is as we age, that area starts to hollow out anyway. And my concern is, what are these patients going to look like in 10 years?
Yeah.
I think they're going to be regretting it, and they're going to have to get another surgery to put the fat back.
That's because that's what you do as you get older.
Yeah, you put fat in, not take it out. So I'm not a big fan of that one. I mean, I think that, I'm more worried about long-term problems than like with Brazilian butt lift, like acute death. Mm-hmm. So, but yeah, I like to look at these new things when they come out, and, I'm never the first person to jump on some train.
Yeah.
I want to see research on it, long-term outcomes, because, at my point in my career where, I stay pretty steady, like I'm doing things where I know people are just going to be like, this is great.
Yeah.
And so I'm not excited to do things that are, experimental or, we don't have a lot of long-term data on, personally.
So I'm going to shift from you as a physician, okay? And I'm going to go, if you go on any of his social media, you can know that he's got a daughter and she's all over. She's fantastic. Love her to death. But as a father, okay, with going back to Texas Best Docs, like, as a father, how important is it to have a tool like this that can be an asset to looking up a doctor?
Yeah, totally.
And when it comes to your daughter, and that other doctor we talked about, where it can't be alone with a female patient, you don't want your daughter going to that. So having this tool to be able to make that decision, you can still go if they've got a board action, or if you can make that decision.
But at least
yourself.
you have that information.
Exactly.
Yeah, no, I think that's great. And yeah, absolutely, we always are very protective of our children, and absolutely, I want my own daughter to go to a physician that's going to have her best interest in heart. And so, yeah, I mean, I'm 100% behind you guys. I mean, I feel like the goals that we have are very similar. I focus more in one specialty. Why? Well, because that's my specialty.
Yeah.
But the principle is the same. It's to protect people, and I hope people's daughters watch my show too and say, okay, I feel like I have more information to be protected because I know what to ask for and what to look for. So. Yeah, absolutely. I applaud you guys, and I hope my daughter's out picking a doctor. I hope she looks at your website. I mean, I feel like maybe I can give her some insight, because I get people all the people ask me all the time, what doctor should I go to? You want to know who the best docs are. You ask doctors who they go to, because we all know,
Yeah.
And it doesn't mean that the other doctors aren't great, but all the doctors know who's okay, really, really good.
Yeah, and that's another side of the site where physicians can put their doctors that they really like in here and keep an eye on them.
So I didn't know that.
You can have your own physician space where you can, if you're referring somebody to post-care somewhere else, you can make sure that.
It was funny. I'm getting kind of up there in age, so I'm at that age where I had to go get my colonoscopies and stuff. And so one of the risks of colonoscopies is if the colonoscopy punctures your intestine, well, then you have to go to surgery. And so I was sitting there with my wife, and I was about to roll back. I was like, hey, listen, if anything goes bad and they have to take me to surgery, these are the doctors you need to call. No one else. These two, call these doctors. So anyway, yeah. But
we need that list for everybody else.
Right.
That maybe wants a colonoscopy.
Yeah, I know. I feel for people because medicine is so complex, just in and of itself, and trying to wade through who's good and who maybe is not quite as good. I do think that, in the United States, there is a fair amount of protection. People that are allowed to practice medicine have at least met a minimum threshold. Is that always enough? I'm not sure. And that varies state by state. some of the laws in Texas to me are a little loose on doctors. If I'm being super honest, as I always am, you know, doctors carry a lot of protection here, and some states are worse, like Florida. You know, so I think there's a balance. You know, some states are very not protective against doctors, and nobody wants to practice there, and that's not good either.
No.
You know, there has to be that balance between, okay, we hold our docs accountable, but also, you know, we're not letting them run wild and do anything.
Yeah.
So I think that's great. I think that the Best Docs is, you know, I hope it'll be like a place for patients to go to get that just little bit of extra information that might help them.
Yeah. Well, thank you. I knew we were going to have a great time today.
Yeah, absolutely.
A lot of interesting stuff. Everything that you bring to the table is invaluable. And
thank you.
Again, if you check the description below, because you can find his YouTube show that he's got as well, and podcast. So all of that information's in the description. But to our audience, thank you again for joining us on Texas Best Docs. We hope you found this episode both informative and inspiring. Stay tuned for more stories from the front lines of healthcare right here on Texas Best Docs. Don't forget to visit www.texasbestdocs.com to get started on finding the best healthcare for you and your family. And as we said before, you can stay informed in your healthcare decisions for less than a Netflix subscription. So, no brainer. If you have any questions or feedback, feel free to reach out to us through our website or follow us on all social media platforms at Texas Best Docs. You've been listening to Texas Best Docs with Kaylee Pear and Dr. Bruce Hermann. Until next time, take care and stay healthy, Texans.